Tim is a patient that I worked with. He was a very high-level basketball player and football player for his age, but he was 9. When you're dealing with someone who's 9 years old undergoing ACL reconstruction, there are a lot of factors and a lot of dynamics that go into that. First of all, kids that young, this is the most serious injury they've had in their life, so there is a lot of anxiety and unknown that goes into that, not only for the patient but also for the parents. This oftentimes is the first time their child has had a surgery or had a serious injury.
One minute he was healthy, the next minute we're dealing with what exactly happened and what exactly is this, and we've heard of ACL injuries before, and so we just had so many questions around what this was going to mean to our young son. He was 9 at the time.
Just pretty shocked. I mean, I knew a little bit about it, but I didn't really know too much about it, and I didn't really know the whole process.
All right, so the next one we're going to do is 2 in, 1 out, forward zigzags. Education, understanding, reassurance, providing the long-term plan and goal really goes a long way in the initial steps of creating a base that we can work for to actually meet our goals.
The program that Marc and his team put together, we knew exactly what was going to happen over the next 6 to 12 to really 18 months, and it was clearly laid out, very organized. We saw the different phases, the different milestones. They were very upfront and honest with us.
They, knew a lot about it. They told you what they're going to do and how is it going to help you, and they tell you you need work on it, but in a nice way that makes you feel like you're not totally just done because you're injured.
Up and over. ACL injuries are very common in age 15 to 30, but they do happen in 9-year-olds. They do happen in 48-year-olds. So how do you deal with them? Do you know what to expect? Do you know what to anticipate? Do you know what changes to make based on those things? So that's where the team approach with our surgeons, our physicians, our athletic trainers and physical therapists really plays a huge role in being able to have some of these complex cases that are a little more unique still have the same level of quality care that we expect for all of our other patients.
He's doing great. He just finished up his first full basketball season.
I barely even notice it's there anymore. I just forget about it sometimes, and I forget that I even had ACL surgery. I mean, it's kind of weird to think about that.
Good job.